name is Melissa. I'm a fourth-year medical student in the integrated medicine elective.
Hi, I'm Haley. I'm another fourth year student in the elective, and we're going to be talking about the built environment and how it affects our health. So to start with, what do we mean when we talk about the built environment? Essentially, it's the intentional infrastructure that's built around us. So we've focused on three main aspects: green spaces that are in our communities, third places, which we'll define later, and then transportation, which we in that category include both like public transit as well as our roadways and any infrastructure that gets us from point A to point B.
So to go ahead and get us started, what is a green space? It's usually defined as an outdoor space that is reserved for parks. It includes plant life, grasses, trees. It may also include features that are considered blue spaces, which would be like lakes or like man-made bodies of water. It can include built environment, so it doesn't necessarily have to be like a forested area that was naturally occurring. It can also be something like the example we have here, like Central Park, which is completely man-made. And it can also have those less managed areas, like I mentioned, those woodlands. So how can green spaces help? This is kind of just an overview. We actually grabbed this from like the European Union advocacy of green spaces, but it really does have a lot of effects on your psychological, mental health, physiologic health, cardiovascular systems, immune health. It has benefits also to like maternal and fetal health, dementia, and other neurological benefits. We also noticed as we went through this project that there's a lot of benefits, particularly for individuals that are in lower socioeconomic status, and so that's something that we just kind of wanted to stress on who can really benefit from these built spaces. So, backwards. Thanks.
Okay.
Yeah, okay. So we're not going to be able to go through all of those things. As you noticed, it was a really big, long list, so we picked just a couple to dive into with you guys. So first off is the effects on green spaces and the immune system. The particular study that I'm going over is here. That is actually just like a review of many other studies, so we can get kind of like a broader overview of what the potential benefits are. This looks at I think it was like 13 animal models and like 20 human studies, and so kind of gives you an idea of how they decided which studies were relevant from their large cases when going through the literature. All right, so from the human studies, they looked at a couple different effects of nature, and so the one that we mostly wanted to focus on here is like the forest bathing and the waterfall exposure, because those are the ones that are directly tied towards the green spaces. And as you can see in the human studies, we have a lot of potential effects to the immune system as far as increasing your natural killer cell numbers and cytotoxic activities, and just generally boosting the immune system has a potential effect for keeping people preventatively to keep people healthy. So another one, because I'm interested in going into pediatrics and Haley here is interested in OB-GYN, we thought that we would add something on maternal and fetal health. The exposure to natural environments during pregnancy was studied across European cohorts. So these 11 birth cohorts were all across different European countries, and it showed that there was actually lower odds for small for gestational age for the pregnancies when the babies were born. Small for gestational age is not it's not directly a negative thing, but it has a lot of associations, and there's a lot of increased risk for other complications. So it's been associated with prematurity, neonatal asphyxia, hypothermia, hypoglycemia, hypocalcemia, sepsis, death. So it's something that we tend to look at as far as a measure. A lot of neonatal populations are varied, and so doing the studies on this very, very heterogeneous population can be very complex, and one of the things that we tend to look at as far as neonatal health is that small for gestational age. I also wanted to point out that study was they actually controlled for alcohol consumption as
Sorry, I'm
No
really
worries.
bad at this.
Thank
Okay.
you. Okay. It was also controlled for alcohol consumption and ethnicity, as the way that the study was done was they looked at where the patients were living and how close in proximity they were to green spaces. And so as you can imagine, there was a lot of overlap with the socioeconomic status, and to further try to analyze it without taking that into consideration, they stratified their data based off of the socioeconomic status. But because it's very difficult to pull data away from something that is that affects so many different aspects of life, they tried to adjust for these other areas. It's still hard to say, and obviously the study is likely still affected by that aspect, but that's something just for us to consider as far as who can really benefit from these areas.
I skipped one.
No worries.
Sorry.
Also, I just noticed the last point there that I forgot to mention, but they did identify that there was even a greater benefit to those green spaces when controlled for all of those data points.
Okay. And then one other positive aspect of green spaces that we found was a study that looked specifically at older individuals over the age of 75 and how differences in the amount of green space, like they stratified it into 3 different levels, high, medium, low, based on a number of different factors. And the participants in the areas that had really high amount of green space were significantly reduced risk of dementia by like 24%. So it's just one other way that green space can have positive effects throughout life.
So now to talk a little bit about the third spaces, so shifting away from a specifically green or natural environment. Third spaces can include those green and natural environments, but it's really a separate definition. So occupants of third places have no obligation to be there. It's not like their work or their home. It's kind of that place in between. It can include some commercial spaces. So although it can include parks, it can also include cafes. Starbucks is technically considered a third space, and actually there's some discussion on what that means for a commercial area to take the role of a third space. And really it's an area where they consider it a leveler, where there's no requirement. It's not like a country club or a yacht club where you need to pay a membership to become a part of this space. It tends to be where conversation is the main focus, and so it has a lot of association with socializing, especially for older populations, and it also has a lot of potential just for ideas and communication. It has to be somewhere that's open and readily accessible, something where everyone can access and go to. And then this is something that I thought was very interesting. It has a low profile, and they also discuss it as the mood. But essentially what it means is it's not like this extravagant place. It tends not to be snobby or pretentious, and it's very accepting of all different demographics. So why are third spaces important from health? When you read into the urban planning, it says that they really emphasize the role of community and socialization, as I was saying earlier. There was one little study from the University of Southern California that was actually saying some of the psychologic benefits were similar to those that they saw from the green spaces and the urban parks. And I was just looking at their college campus. Actually, when I was going through this, I was really thinking about how college campuses do a really great job of thinking about those third spaces, all those areas where you get to study and relax and talk and communicate. There was a British study that actually evaluated third spaces for social support, and they again recognized the people that were most benefiting from these third spaces were those who spend most of their days at home because they're unemployed, they have poor health, they're retired, or they have child care responsibilities. Just again to keep us thinking about who most benefits from these measures in our built environment. So then we're looking specifically more at health, and one population we wanted to focus in on are older adults. The third place for older adults tends to be an area of social engagement. I specifically picked this picture. I don't know if you guys can tell, but it's Domino's, because it's something that's very relevant to the Miami area. It's something that's kind of popular, and we do have parks for that. And so I think it just is a really good representation of how a third space can form community and encourage socialization. This study is again a review, and so this was 12 quantitative and 20 qualitative studies, which is very interesting to see what they looked at. And so again, these third spaces can be open and green spaces, but not always. So this is a little bit about how their eligibility criteria was passed. We can just go over that. And essentially what they said was these third spaces needed to be local, they needed to be convenient, and they needed to be comfortable. So this is some of their data from the quantitative studies. I tried to put this here like with the little faces to give you an idea, because I think it's a little confusing. But basically when they analyzed the studies, they looked at whether or not it was significant, whether it was significant, whether it was not significant, whether it was mixed, and if they had a surprising, it was actually the opposite of what they thought. And so this kind of gives you a sense of what studies showed that. And so basically if it was significant, it was that the social interaction was improved. If it was the you or the like confused face, it was that it was like the opposite of what they were anticipating of like increasing the social interaction or social network. And then the mix again is mixed and not significant, is they just didn't find enough. So one thing I thought was interesting, because next we're talking about like transportation, is the transition spaces. And so transition spaces would be those things like where people can like walk to and from, and that had a lot more like non-significant or mixed data for the social interactions and social networks, versus things like the open green spaces had a lot more like significant for the social interaction, but maybe not so much for the social network.
Where was the surprise one? Where's the surprise one?
It's the U column here. But
Oh,
it's like
unexpected.
yeah, unexpected.
Oh, okay.
Like it went in the like opposite direction, but was still significant. So, and then this one is the qualitative studies, and so again looking at these different areas like the open green spaces versus local businesses and transitional spaces to see how they affected the social interaction and the social network.
So the more those cited studies are listed, those are more positive findings on, okay.
Yeah, so these are like the positive findings,
Okay.
which I thought was very impressive. That once again, like you're seeing a lot of the social interactions for the green spaces and the local businesses. Okay, so just some gaps again, because like this was a very big study, and some of the things that they didn't really look at was like longitudinal effects. So they didn't really see much on like how the socialization affects us. It's still an area where we have a lot more to learn about. We also don't really understand like the relationship quality of that social interaction. So for example, if you're having the social interactions from your cafe, like is that really meaningful enough to make an impact on the person or make an impact on their health? And then the attributes of the local park that foster the social interactions. So we were looking at basically like one of the studies specifically, the quantitative study found that the various attributes of the parks and the greenways were not contributing to the social interaction, which I thought was very interesting, because we tend to think about like what we're building and being thoughtful about what we're building, but maybe it doesn't matter whether or not it has certain like features. And so things like benches is a really great question, is whether or not this is like beneficial. And you can make an argument either way, but the baseline of this was that we don't have support right now. Maybe there will be more data. And then more diverse studies. So again, it's difficult to analyze the socioeconomic status, because a lot of these spaces are located because of where they're naturally located or currently built.
Okay, so shifting to our third topic, which is transportation, and we kind of included 3 different aspects here. So public transit, sort of all forms, but whether it be a bus, like we have in Miami going to South Beach, or metros, or any sort of system for the public to get from one place to another. It includes both like an environmental impact in terms of the use of fuel, and if we're all taking cars and individually sort of contributing to more greenhouse gases versus shared transit, reducing those. But there's also can be some negative effects, just like with cars, like air pollution, noise pollution. Sidewalks is another thing that we considered the impact of which correlates with like the accessibility of physical activity. And then street design contributes mainly to like the injury risk. So how do we design our streets? Is it in a way such that there's a high likelihood of injury from pedestrians, cyclists, passengers in cars, things like that. So the way that these things are built directly contribute to some of those risks. So specifically with like driving in roadways and the risk of injury, the number of deaths from people walking, like pedestrian fatalities, has been steadily increasing. This one was from 2020 was the latest, and this was their projected for 2021 because the finalized data wasn't complete. But it was showing that even though there was less driving happening in 2020, there were actually more pedestrian fatalities. And so that's sort of directly related to how our roads and things are like designed. So this is a little bit about street design and how it contributes to health in many different ways. So first of all, the public transit, the accessibility of that is important for, like we said, the environmental impacts. Where is the public transit located in relation to residential areas? So like how much interaction are we having with either public transit or with cars, like polluting? There's actually a lot of cities that are considering going car-free, or neighborhoods that are car-free, so that we aren't exposed to all of the like exhaust air pollutants. And then how bike lanes are designed, and how can that design contribute to how safe it is to ride a bike or to walk. So the size of the sidewalks, the shade, the green space, like we had discussed before, the green spaces contribution to health can have a big impact. And then also, interestingly, the just from an environmental standpoint, the green spaces and the way that the roadways are designed impact how other environmental factors can affect our health. So things like flooding can be impacted by the amount of green space within or near sort of our city and our roadways. And so interestingly, there was a paper in the Lancet that showed that up to like 89 minutes of physical activity can be contributed to your built environment. So how likely someone is to have physical activity is highly influenced by the availability of green spaces and spaces where you would want to be outdoors, the availability of public transit or access to safe sidewalks and bike lanes to be able to use physical activity as like active transportation. So it sort of plays a huge role. So just kind of to recap what we went over, this was a pretty broad topic, the built environment.
Like we probably could have just done green spaces, but at that point we had already kind of liked the idea of like incorporating all the things that we can really, affect, and that we have like active changeover.
And there's a lot of interaction sort of between these different spaces. Like when Melissa was describing the overlap between third places and green spaces, how some of those can be the same. And then there can be sort of counter effects, like when she was looking at the study that showed the transit spaces as like a third space wasn't beneficial in terms of like encouraging social interaction, but it's very beneficial for other ways in terms of physical activity and the presence or absence of the amount of like pollution. So ultimately, city design, urban planning, and just the built environment in general can have a huge impact on the health of everyone in the community.
And again, especially focus on the amount that it's able to support and encourage those who are at lower SES